Hi, my name is Tarek Hussein. I am the owner and manager of Weller Pharmacy, which is an independent community pharmacy in Kingston, Ontario. In my practice, we've been always early adopters of digital technology, and recently we've been using e-prescriptions as well. I first learned about PrescribeIT a few years ago. I actually approached the company and asked them, how can we get this service into our pharmacy? And that's why we were one of the early users of this service. Before PrescribeIT, the prescriber would print the prescription or give it to the secretary, it'd get faxed. We spent so much time trying to get a prescription, like a refill or even a new prescription. Now with PrescribeIT, it connects the prescriber directly with the pharmacy. Once the prescribers issue the prescription, it is sent to our software and it seamlessly integrates with the patient profile. It allows us to process the prescription in a much faster way. Pre-populated prescription like PrescribeIT is helpful because there's a lot of information that comes with the prescription that we may not have, including, for example, allergies, some other medical conditions, specific directions that are clear. And this allows better medication management and seamless communication with the prescribers. I actually think PrescribeIT can eliminate fraud for two main reasons. First, there is no pads that the doctor will write on. Nobody can change or alter the prescription that is written on. And it is coming directly from the prescriber's kind of secure system to a pharmacy secure system. So if everybody is using PrescribeIT, I don't see a room for fraudulence. I would love to see every single pharmacy, pharmacist, and clinician using PrescribeIT from yesterday, not today.